assessment today. Can you verify your name and date of birth, please?
Megan Trello, January 4th, 1995.
So patient appears her stated age. Can you tell me where you are?
At school.
Why?
In class.
And what's the date? What day is
April 1st.
Okay. So patient is alert and oriented times 3. Her mood and affect is appropriate for the situation. Hygiene and grooming is appropriate and well. Her speech is clear and responsive to the questions. Are you in any pain?
No.
And do you have any allergies?
No.
Okay, so there are no obvious signs of illness. And I'm going to start with your face. Skin is warm and dry. There are no masses or lesions. The face is symmetric. Can you puff your cheeks and smile? Cranial nerves 5 and 7 are intact. I'm going to examine your eyes. Pupils are symmetric. I'm going to shine a light into them. Keep looking forward. Okay, pupils are pleura, and I am going to check the conjunctiva. It is pink, and I'm going to move on to the mouth. Can you open up? Your buccal mucosa is pink and intact, no masses or lesions. Teeth are all present and symmetric. Can you stick out your tongue and say ah? The uvula retracts and tonsils are a 1+. And her gums are also not retracting. Her tongue has no masses or lesions and is pink and moist as well. I'm going to check her carotid pulses. They are 2+ bilaterally. I'm going to listen with the bell. There are no signs of bruit. I'm now going to do the upper extremities. Patient's skin is warm and dry and proper color for the ethnicity. Brachial pulses are 2+ bilaterally. Radial pulses are also 2+ bilaterally. I'm going to check your fingers. Capillary refill is less than 3 seconds bilaterally. The nails are pink and properly kept up. And can you go like this, please? There's no clubbing present. Can you squeeze my fingers? Patient's grasp is proper. I'm going to move on to the heart and lungs. First, I'm going to listen to the lungs. I'm going to have you take a deep breath every time I place this. I'm going to listen in 10 spots in the front. And 2 spots laterally. And on the other side. And then 10 spots on the back. You don't have to deep breathe every time you're going to. And that was 10. I'm now going to percuss the costal vertebral angle. Tell me if there's any pain or tenderness.
No.
No. Okay. So patient experiences no pain or tenderness. I'm going to move on to the heart. Now listen here for 60 seconds for the apical rate. I'm now going to follow back up with the diaphragm, or the bell. It's called the diaphragm. Okay. Oh, and lung sounds were clear, no adventitious sounds present for the lungs. So the aortic spot is the second intercostal space on the right side. Pulmonic is the second intercostal space left side. Herbs is the third intercostal space left sternum border. Tricuspid is the fourth intercostal space lower sternum border. and the mitral is the 5th intercostal space, left midclavicular line. So I'm now going to move on to your abdomen. Can you please lay back? So contour is flat. I'm going to auscultate for bowel sounds in all 4 quadrants. Bowel sounds are present times 4. I'm now going to percuss. So there are tympanic sounds above the hollow organs and dull sounds above the solid organs. I am now going to palpate. Let me know if there's any tenderness. No tenderness? Okay. I'm going to name the organs in each quadrant. The right upper quadrant has the gallbladder, liver, right kidney, pancreas, the transverse and ascending colon. The left upper quadrant has the stomach, spleen, left lobe of the liver, pancreas, left kidney, transverse and descending colon. The left lower has the sigmoid and the descending colon, and the right has the cecum and appendix. Okay, so I am now going to have you sit up. Your patient experiences no JVD in that. And I'm now going to do lower extremities. Skin is warm, dry, proper for patient's ethnicity. There are no masses or lesions. I'm going to feel for the popliteal pulse. So 2+. Tibial, also a 2+, and the dorsal medius is a 2+. There's no edema present. I'm going to do the Babinski test. It's negative. Can you please stand up? Can you bend over and touch your toes? Okay, the spine is aligned and S-shaped. Can you stand with your hands at your waist and feet together, eyes closed for 30 seconds? This is the Romberg test. Patient has negative Romberg. Can you please walk in a circle? Patient has natural steady gait for the get up and go test. And this concludes my assessment.